Good, so I just have to ask you, as you always say on Twitter, has Oregon lost its ever-loving mind?
It's a difficult prospect. I think all of us have come to realize how much power these unelected health directors across the country have wielded against our lives. I had no idea how many minions there were within my county government that could suddenly crush the spirit of my kids, myself, my business, my church. And it's really an unforgiving, unrelenting push. I think once you put the clown makeup on, it's both sad and also, I think, particularly poignant, perhaps even ironic, given it is, as you say, a clown show.
And these petty tyrants don't seem like they're going to be giving up anytime soon. I mean, it's been already 6, 7+ months of this, and they're still going strong. And we see specifically in Oregon, but this is a pattern we've seen throughout the country, is that these petty tyrants say, look, the cases in these states are at their highest level since the beginning of the pandemic. Therefore, we need to shut down again. But when it comes to these cases, should we be worried about rising cases, or is there something we're not missing there?
Look, there is a distinct separation in the charts now between cases and the testing regime we have and the typical hospitalizations and deaths that would typically follow. Right now, according to different state data that we see, about 15% of people who contract the disease over the age of 65 might be hospitalized. Turns out that's about the same rate that you would get if you contracted influenza. Now, we know that COVID is a challenging disease. It's one that we've been able to handle. That rate was twice or three times what it was several months ago. And one of the things we have to realize is that the numbers that you are seeing are not actually the true numbers. You might see it bantered about right now on the news that there have been 1,000 deaths a day this week. That is not the case. What happens is those deaths lag, they get reported as new deaths. But when the CDC goes to unravel all those death certificates, they find out that they layer into the past. And people have been finding death certificates as far back as March, reported just this week. So when someone says 1,000 deaths a day, it's inaccurate, it's not true, and it's simple fear mongering. We hope, on the backside of this virus, but we're also coming upon flu season. But we should basically curb our efforts to focusing on those who are most vulnerable. A shutdown makes no sense right now.
Yeah, the key always should have been to protect our most vulnerable. However, we seem to have ignored them, and in some places like New York, made their lives even worse by importing more sick and ill people with COVID into the nursing homes while we policed all the bars and the schools and elsewhere with younger people who are completely fine when it comes to this virus. But going back to a second to the flu, since we are, coming up now on cold and flu season, we're hearing from officials that this is going to be a cold, dark, long winter, that there could be a twin pandemic between COVID and the typical seasonal flu strains. Are you seeing that? Because we're also seeing reports that seasonal flu is down 98% in some cases.
Very, very low here in San Diego, for example. From the case of July through October, we would typically see 300 to 500 cases of influenza. We've had three. And that isn't because there isn't cases of influenza. That is because the testing regime is basically merging these together, we believe. And so COVID has become basically the new flu. That's one theory. There are many other theories going towards it. We're going to need to get a few more weeks into flu season before we really understand what's going on. But right now, the numbers are all over the place. It's a mix mash. And the terrible testing regime, which can pick up a virus that you may have gotten 3 to 4 months ago, is not doing anyone any favors. Most of the people who get tested are either getting retested or in the hospital for other reasons and have to get tested. And if they come back positive, for majority of the population, it's very, very mild symptoms that they're having, and they just need to get through it.